Today we're going to focus on the administration of medications. As a nurse, administering medications is one of the most important things that we do for our patients. So today we're going to focus on oral medications, even though there's multiple routes that medications can be given. So starting out today, we are starting out at the medication cart. The medication cart can either be in the hallway or sometimes it may be in a medication room. So again, that's going to depend on your facility as to where you're actually going to begin this skill. Today, like I said, we're going to focus on oral medication. So if you're looking at your lab manual, number 1 says set up the medication. Check the 10 rights 3 times. Do not touch tablets or capsules with your hands. Unit dose packages should not be opened until you're at the patient's bedside. So if we're in clinical today, what will happen is your instructor will give you your medication administration record or your MAR for your patient. So for today's patient, we're going to be using Janet Long. So we have our MAR, our medication administration record. We're going to find Janet Long, and here she is here. And for demonstration purposes, we're going to say that it is 9 a.m. and Miss Long has 2 oral medications that she needs to receive this morning. So what we're going to do is we found Janet Long. Next thing we're going to do is we're going to find her drawer. So again, depending on your facility, you may be getting the medications out of a Pyxis or a computerized medication, or you may have a medication cart. So here's Miss Janet Long, so we're going to find her name. When we're finding her medications, the best way to do it is to start at the top and work your way down. So the first one that we're going to do is Practa-Digox or digoxin. So we're going to look in our drawer. We're going to find that medication. We're checking all of our information, and remember that's at least 3 times. We're going to go on down, Practicumi or Coumadin. We're going to find that one. At this time, if you were not sure what these medications were for, then you would need to look them up. In a clinical situation, it's better if you've looked up these medications before you come to your clinical instructor for time purposes, so that we can do multiple students with multiple patients who need their medications all at one single time. So if we haven't already, we would look up these medications. We would want to know what the name, the generic name, is this a normal dose? As well as the indications, why is this patient getting this medication, and also one of the main things that we want to check for are the side effects and things that we need to watch for once our patient has been given this medication. So again, if I had not already done so, I would need to look those up in our drug book. So I understand what these 2 drugs are for. I also understand that for one of these drugs, I need to do an assessment. Again, if you've got a patient that needs to have some type of assessment before you give the medication, you want to do that before you let that clinical instructor know. For instance, if you're giving a blood pressure medicine, you want to go ahead and get that blood pressure, make sure it's in normal range before you come get that instructor to let them know that you're ready to be giving your medications. So for this patient, I need to do an assessment. So I'm going to do that when I go into the room for demonstration purposes. I've got 2 medications to give. I've checked them. This is my very first check when I took them out of the drawer. The next thing that I'm going to do is wash my hands. Again, anytime we're dealing with medications, we always want to make sure that we've washed our hands. Next, we've done all this at the cart in the hallway. So next, what we're going to be doing is going into the patient's room and finishing up this procedure in there. Before I go into the patient's room, I want to take the MAR with me, as well as the medications. I want to close the book on the medication records. Again, for HIPAA purposes, we want to make sure that everything is covered, and for privacy purposes. Also, our cart, we need to make sure that it's locked before we leave. If no one else is standing here, we want to make sure that patients who wander don't open up a cart and take any kind of medication that they shouldn't take. So we're going to take our MAR into the room, as well as our unopened unit dose packages of pills. We're going to knock on the patient's door. We're going to enter the room. Good morning.
Good morning.
Can you state your name and your birth date for me?
Janet Long, 4/1964.
Okay. So we ask the patient to state her name. Remember that it's not very beneficial to say, "Are you Janet Long?" If we have a patient who is confused, then they may just answer yes without fully understanding the question. So we always ask them to state their name. So while she is stating her name and birth date, we're looking at her armband. We're checking all that into the MAR, okay? If I haven't already done the assessment, I would do that at this time. The next thing that we want to do is explain to her, my name is Miss Shoemake. Today I'm going to be giving you your medications, and she'll probably agree with me and say that it's okay. If not, we'll discuss that at a later time of what we do when a patient doesn't want his or her medication. Next thing that we're going to do is we're going to elevate her head of the bed. Really important when we're dealing with a patient who's going to be swallowing some oral medications that we raise that head good and high into about a half hour's position or until she's comfortable. Ms. Long, are you comfortable?
That's pretty good.
Okay. Also at this time, if we haven't already done so, we would make sure that she has some fluids available to help facilitate getting that peel down. The next thing that we're going to do is we're going to again check our medications. And so remember that we check our medications at least 3 times. We did our first check out in the hallway, and our second check and third check we're going to do into the patient's room. So we're going to sit our medications down with our MAR. And remember that you never set medications where you can't keep them in view. So at all times you have your medications in line. Usually the best thing to do is kind of pour them out to the side. And again, just like we did when we got them out of the cart, we're going to start at the top and work our way down. So we're going to find the first one. We're going to check, and this is going to count as our second check. As we check it, we're going to open it up, empty the pill into the cup. Then we're going to do our third and final check after we've opened it, but before we give it to the patient. We're going to go down to our second one, do our checks with it, open it up. Also as a note, each different type of packaging requires a different technique in opening. Some you may just have to push, some you may have to tear. So again, that's going to be something that we'll do once we get to the clinical site. We're going to do our third and final check with our second pill, set it down. We've done all of our checks. We've checked our patient's identity, we've let them know who we are, and then we've done our 3 checks with our medication. The next thing that we're going to do is we're going to hand the pills to the patient, and depending on your patient, you may have to assist them. For a patient who's alert and oriented, able to move, we may just hand the cup to them, and she can either get them out with her hands, or she may just go ahead and throw the pills kind of in her mouth. It's up to her. Sometimes you may have to tap the medication in with your fingers. Remember that if you're not touching the pills, you don't have to wear gloves, okay? Later on we'll talk about crushing or cutting pills, and we may have to wear gloves, but if we're just taking them right out of the unit package, we don't have to wear gloves for this skill. So she is taking the pills. We may just want to say, can you open your mouth and see, make sure that she's not had any problem swallowing. She's had her drink of water, so we're going to ask her, would you like any more of that?
Not at this time.
May sit that on the side so that she can get it later on. Next, we're just going to throw our cup away. If you look down at number 7, we're going to make sure that she's comfortable. Also, just a side note, back up to number 6, it says, do not leave medications at the bedside. We want to make sure that when we come in to give medications that the patient is ready to take the medication. So we're not going to leave them and ask them to take them later. If for whatever reason she can't take them at this time, we're going to take them back out and put them back into the cart. And again, that's why we don't open those unit packages until we are in the room and know that that patient's ready. After we make sure she's comfortable, so do you want to be let down or are you
No,
fine?
I think I'd like to stay this way.
Okay, so next we're going to wash our hands. Then we're going to chart our medications. And remember that if it's a routine medication, it just goes on the MAR. If it's PRN, STAT, one-time order, then those would go on the MAR as well as the nurse's notes. If you look at number 10, we're going to return to assess the patient's response. So again, if we've given something for pain, if we've given something to lower blood pressure or pulse, we want to come in the proper time frame and reassess those. And then again, number 11, we're going to document that assessment in the nurse's notes. Once we get that done, we're going to, again, throw away all of our packaging, return back out to the cart, place our MAR back into the book, wash our hands, and proceed to the next patient.